Hi, I'm Dr. Darren Howarth with Summit to Shore Chiropractic. So, I wanted to talk to you about prevention versus curing injury or improving injury, whatever word you'd like to use. So, first off, I want to definitely explain that I'm not going to 100% guarantee that I'm preventing any injury. Things happen. Sometimes there's nothing you can do about it. However, that being said, there is a lot of prevention and preventative type work that you can do to help yourself move better, which then will decrease your chance of injury. So for one, anytime you've ever been injured, you usually move differently. I mean, you sprain your ankle, you walk differently, you notice those changes. The thing that people tend to misunderstand is the fact that when you heal, you give it whatever, 6 weeks, month, 2 months, whatever months you want to say, the likelihood of that going back to 100% without doing anything about it is pretty low. So your body's good at fixing itself, but it doesn't always move the same afterwards, or it takes a lot longer than you're expecting to get that to change. So basically what I'm talking about is in the sense of, okay, if you have an injury, things move differently. All right, let's get you taken care of, get you moving better, get you feeling better, so then you start moving the way that you used to. That way you're not having to fight this battle of constantly kind of an improper or dysfunctional movement that we know has a tendency to lead toward injury. So again, the likelihood of you having injury is still higher than someone who's never had it. But if we can prep that to where there's some of these things that we constantly see that can make a difference, that will happen less often and maybe less severe is usually what we're capable of doing. Versus trying to just come and cure, I've had this whatever symptom, low back pain for years, it comes and goes. Every once in a while it's really bad, I can't move, I wait it out and it goes away. Some of those things are going to take a long time to heal. There's a dysfunctional or improper movement that you have ingrained in your head that constantly is fighting this pattern that causes injury. So the two big things there is, one, when you're trying to get out of or cure, so to speak, an injury like that, it's a long process. I'm not saying it's not possible, but it's usually pretty long. Versus if you're preventing and trying to keep yourself healthy, it's so much easier to keep yourself healthy than to get healthy. So in the sense of what I would recommend for you to do is do the things that you know will keep you healthy. Eating properly, exercising, moving, stretching, all those things make a big difference in the long run, rather than I'm going to sit around and do nothing and just hope that it gets better. Doesn't usually work well out that way. And that's one of the things I definitely love to teach people here is these are the tools that I'm going to give you to get better. And then I'm going to also give you some of these tools to keep yourself from getting this bad, and if it does, that you know how to get yourself moving again, or how to get feeling better. But prevention is a big part of it. There's so many scenarios where prevention is your better option. But yeah, so that's what I've got for you today. If you have questions, email, check us out on Facebook. Love to hear from you. But thanks for watching. We'll see you next time.